This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
You know, year after year, we absolutely love having our next guest on the show because she is such a passionate advocate for crushing stigmas. Today, we're talking lung cancer.
And if your mind immediately goes to smoking, sit tight for a moment and listen to what lung cancer survivor Dina Cook has to say. PRMC's lung cancer program coordinator, Lauren Moore, is also with us. Thank you so much, ladies, for joining us today. Dina, we've had you on the show before, and we just love having you back, as we mentioned. But for those who may not be familiar with your story, take us back to the summer of 2012.
Well, in July of 2012, I had surgery. I went in with my lungs intact, not knowing I had lung cancer, came out without my lower left lobe with a diagnosis that my husband told me that I had lung cancer. 9 months later, I had my second surgery for another primary tumor that was in my upper left lobe. So I'm a two-time lung cancer survivor.
Wow.
I'm here because it was found early, which I'm one of the very, very lucky lung cancer patients.
Well, risking this with my wife, you look great.
Well, thank you.
You look absolutely, so
Thank
congratulations on twice.
Yes.
Did you even suspect that something was wrong?
Not at all, not at all. I basically had bronchitis that started in the fall. My doctor, thank goodness, suggested a chest x-ray to rule out pneumonia. And from that, which was in 2011 until July, they were following a tumor nodule that was in there. It was starting to change, so that's why it was taken out. I am a former smoker. 30 years ago, I smoked. It was not on the radar because I did not fit the profile at that point in time for lung cancer. And since then, since that time, I've done an exceptional amount of research, especially after the second time around, and have become a very serious advocate, activist, particularly with the Lung Cancer Alliance that's in Washington, D.C., because the government has to do something about this disease and the stigma that surrounds it, which I think is obviously affecting the research funding.
And that's why you're here, because you want to break that stigma that, you know, when people hear the words lung cancer, they don't automatically think, well, that person smoked.
Right.
So
it's their fault.
Right, right. And it's devastating to have a diagnosis of cancer, period. But when you tell somebody that you have lung cancer and the first thing out of their mouth is, did you smoke? It automatically puts guilt, whether you smoked or not, whether you smoked yesterday or you smoked 30 years ago or you never smoked. It puts guilt on the patient, and that's not fair. You're dealing with enough. So please don't use that. And I'm going to give you my End the Stigma
bless your heart.
bracelets
I
so
love
that.
Nice.
Thank you.
Because
that's terrific.
Unfortunately, the stigma affects so many things, and lung cancer is by far, per death, the lowest funded cancer in the world. And lung cancer kills 100,000 more people every year than the next deadliest cancer. 100,000 people. So we've got to do something.
Got to do something. Lauren, let me ask you this. Just as Dina was saying, you don't have to be a smoker. The only prerequisite to lung cancer is to have lungs.
That's right. So Dina is exactly right. Although the majority of patients that we see have smoked or continue to smoke, there is a significant portion of patients who may have other environmental exposures, such as to asbestos or radon gas or other air pollutants. And in addition, there's certainly the risk of maybe one of their family members had lung cancer, or maybe multiple family members had lung cancer. And so that puts them at increased risk as well.
Now, one of the ways to detect lung cancer is obviously through a screening. Who should get that screening?
So the screening is with a low-dose CT scan, and it's specifically targeted towards that group of people who smoke or have smoked in the past. There was a national lung screening trial that was done that showed that there was a 20% reduction in lung cancer deaths when you compared low-dose CT scans to annual chest x-rays. And so for that reason, thankfully, insurance companies have come on board to provide these for their beneficiaries. So Medicare beneficiaries are eligible if they have smoked at least 30 pack years. They're between the ages of 55 and 77. They're either continuing to smoke or they've smoked within the last 15 years. Other insurance companies, maybe private insurance companies, they may even cover their beneficiaries up to age 80.
Yeah. So, Dina, do you think it's important if somebody has stopped smoking, get a scan?
Absolutely. I would not qualify for the screening, and I had lung cancer.
Yeah.
I didn't smoke enough. I quit many years ago, 30 years ago. So I'm living proof that you can get lung cancer no matter what. And there are a lot of people that are getting lung cancer that never smoked. We have a program that will save somebody's life. And my fear is that people have, due to the stigma, the government has told you if you stop smoking, you won't get lung cancer. Well, guess what? If you smoked 13 years ago, you could get lung cancer. If you smoked 30 years ago, you could get lung cancer. You have a screening program that's available that could save your life. Lung cancer is an insidious disease. It does not have symptoms until it's spread. 86% of all lung cancer patients are diagnosed after it has metastasized throughout their body, which is not a good thing.
Yeah.
So we need to get people screened. People are not getting screened, so that is our focus is why not save your life? You get a mammogram, you get a colonoscopy. If you qualify, get screened.
And that is why PRMC is holding 2 events, Shine a Light on Lung Cancer events. Tell us about that.
Dina, go ahead, I'll let you talk about that.
Well, this will be our 4th year in Salisbury that we've held a Shine a Light sponsored by the Lung Cancer Alliance and PRMC. It's a time, number one, to bring together people that have been impacted by lung cancer. And we want patients, we want people who have lost loved ones, we want people that want information because they're concerned that they might be at risk for lung cancer to get together with us and share information. And I really encourage lung cancer patients to come. I was empowered when I finally met my first lung cancer patient and was able to talk to them and relay how I feel about the disease, my concerns and different things. Right. And that bonding is very important for everybody. So we reach out and really want everybody to come, and we're doing one in Salisbury at the Ward Museum on November 2nd. We're doing our first one in Berlin at the new Cancer Center, PRMC Cancer Center, on Wednesday the following week on the 8th, and they both will start at 6 o'clock.
Thank you.
It's a free event, and we look forward to seeing people.
Be there.
Dina and Lauren, thank you so much for coming in. We want to see you back here.
Yes, we do.
Yes, we do.
Do it again.